Hello, everyone. Welcome to today's webinar, hosted by the American Public Human Services Association, or APHSA, in partnership with EY. Today's webinar topic is Designing for Impact, a human-centered approach to child welfare. My name is Alex Claremont, and I'm the senior content writer here at APHSA. I would like to take a minute to share with everyone an overview of APHSA and what we do for and with our partners. APHSA is a membership organization that represents state and local human services agencies from across the country through their top-level leadership. We're a bipartisan organization focused on building common ground. We aim to deliver for our members through three core channels. That is, influencing modern policies and practices with the goal of strengthening communities, building capacity through our conferences, technical expertise, publications, and technical assistance and training consulting practice, and connecting members with key partners. Speaking of connecting members, I invite each of you to save the date for the 2025 series of APHSA conferences. These include our National Human Services Summit, which will be held from June 1st to June 4th in Philadelphia. Also keep an eye out for Economic Mobility and Wellbeing Conference, happening in August in Minneapolis. In September, between the 14th and the 17th, we'll be hosting the ISM convention in Reno. During the month of October, we'll be hosting both the NSDTA and the APHSA Education Conference. Check out our recently relaunched website, aphsa.org, for updates on each of these conferences. Now, before we begin, I'd like to go over some light housekeeping. During the presentation, we request that you put your questions for our presenters in the Q&A panel rather than the typical Zoom chat feature. If possible, panelists will try to answer your questions during the presentation, but there should also be time left at the end for questions. Lastly, this webinar is being recorded, and it will be shared with all registrants in the coming days. Next slide, please. Now, it's my pleasure to introduce the moderator for our panel discussion, Greg McKay, Executive Leader at EY.
Well, thank you, Alex, and way to ad-lib there. You know, it's always something, right? But great job. Good day, everybody. My name is Greg McKay. I am with EY as their Executive Government Leader over Health and Human Services. I'm happy to be here today. I'll give you just a brief reason why I get the opportunity to moderate a panel with professionals like this. Is I spent 28 years in government before joining EY. I was with Phoenix Police Department for 20 years in major crimes, mostly homicide or crimes against children. But after 20 years, I had the opportunity to have a second, even more rewarding career in child welfare. I was part of a kind of a mixing of child protective services with criminal investigations and law enforcement to hopefully avert, catastrophic cases of child abuse or worse. That led to me being able to serve as the director of Arizona's Department of Child Safety for 5 years. And we had the great distinction of being the 50th worst ranked child welfare system in America. And this was back in 2015. So anyway, it was a great transformation in Arizona that we are just so blessed to have experienced. And part of that transformation was a new CCWIS in Arizona that started in about 2016. And I think Arizona was the first end-to-end CCWIS in the country. And it was a heavy lift, and it did not come without a lot of pains and a lot of benefits. So, but we didn't have the focus on human-centered design back there. So, but what we did do is go through processes and kind of determine where people are impacted, negatively or positively, by the use of technology. So now this is a great segue into why we're here today and what human-centered design is. And our great panelists here are going to explain that and many more things in our time together. So I'm going to just give them about a minute or two to introduce themselves and who they are and where they've been and what they're working on today. And then we'll get into a question and answer session with them. I'll just say this up front. Oftentimes we ask many questions coming in from the audience during the presentations. For this particular webinar, we're likely going to take the questions and respond to those after the webinar, potentially with more contact with the person asking the questions. So that's the way we're going to do this. But anyway, I'm going to kick this off and introduce Chris Giannuzos, who is the managing director at EY. Chris, give us a quick introduction of you and what we're doing.
Thank you, Greg. Great to be with you today. I'm Chris Giannuzos, or Chris G, since that is such a mouthful. I lead the customer experience practice for EY's government sector, and human-centered design fits squarely in that area of expertise. We have a tailored version of it for our government clients that we call human-centered government. I've been doing customer experience and digital transformation work for 25 years. I spent the first almost 2 decades of my career doing that type of work for tech, media, and telecom companies, really helping them press the edge of innovation as it comes to thinking about digital transformation and CX. And then several years ago, began to bring some of that same approach and lessons learned and thinking to the public sector. So I've had the good fortune to be serving as the engagement partner for the work with VDSS that we will discuss today, and just thrilled to be part of the conversation.
Thank you, Chris. Heather Davis, let's go to you, please.
Hi, thank you, Greg. My name is Heather Davis, and I am a project manager with our Division of Family Services Business Operations team. So just to give you a little bit of background about me, currently I am overseeing our CCWIS project and also operations and maintenance of our legacy systems. And prior to my job as a project manager, I worked for the state as a QAA reviewer. So spent some time doing some Title IV reviews, also the Child and Family Service reviews here in Virginia. And prior to that, and most importantly, I think I was a frontline worker. So primarily focusing on foster care and adoptions at a local agency. So I bring to the table about 20 years of experience from kind of all realms of child welfare. And since moving to the state, I did, sorry, my voice is a little bad, getting over a cold. I did go ahead and obtain my PMP and Safe Agilist certifications, and pretty much the whole gamut of child welfare I think I've worked on. So I think that's enough. Greg, do you want to pass to Christina?
Perfect. Yeah, Christina, how about you?
Thank you so much. I'm so happy to be here. My name is Christina Riley, and I have my master's degree in social work, and I dedicated 17 years of my careers to a local Department of Human Services, where I served as a frontline family engagement specialist working on reunification, and then also did structural family at a local Department of Human Services, really working on with families and the process and the emotions with what it was for them to be in the child welfare realm. And then also I transferred to the state as a change management specialist 6 years ago, where I got to really tie that why to the technology piece, and like what we're doing here today with the human-centered design. And I was able to see a mobile technology implemented during this experience in the past 6 years. So I'm just happy to be here and keeping that why tied to the technology.
Great, thank you, Christina. And Heather, we can hear you just fine. Thank you for making it through. We hear you loud and clear. But well, excellent, you guys. And I mean, just such great, rich experience here, long-lasting experience, diverse experience that really lends to a project like this that affects so many different people in so many different ways, and the merging of technology with the programs is just vital. So, Chris, first question is going to go to you. So how about a simple basic, what is human-centered design, and how is it relating to government services?
Yeah, human-centered design at its core is a discipline that helps us think about new customer experiences. And those customer experiences can be internal ones for agency staff and caseworkers, or it can be the experience that those that we serve go through. And really at its core, it's about using empathy to think about the characteristics and emotional state and physical and mental state of an individual as they're going through a set of processes, and how that manifests itself in their way that they interact with an organization or with an agency. This is, I mentioned in my introduction that I spent the first 20 years of my career in the private sector, and this is very much the way that retailers and streaming providers and other customer-centric organizations think about providing new experiences for their customers, and those techniques are just as relevant for government agencies. So it's really about how do people experience a set of services? What are the steps they go through? How do they interact with technology? How do they interact with offline processes? What are the moments that matter and the key pain points that they experience during that? And then using that to redefine what a new experience could look like. Some of that manifests itself in technology change. Most of it manifests itself in process or policy change. But it's really about making things more approachable for an average user, or an average constituent. If you think about it, oftentimes we have little mini silos in a process, and those silos may work very well. But in aggregate, when you start to string a bunch of those together, those can become very complicated. And that is often what what those that we serve experience as they're traversing multiple sub-agencies or multiple departments. So we think about reworking that using language that is more approachable. Most people don't speak government, right? They don't necessarily understand the jargon and the acronyms and the policies that those on the call deal with every day. They just know they have a set of needs that they're trying to address. But at the end of the day, human-centered design or human-centered government really reorganizes our thinking around the mission, and how does that mission show up to those that we serve, and how do we make things better and easier for our constituents to use, and how do we simplify and streamline the processes for caseworkers so that they can spend more time on that actual casework and less time on transacting with systems and processes and offline things. And really at its core, that's what it's about. Everyone got into this work to serve people, not to deal with those internal processes. And human-centered design really helps us think about more efficient ways to do that.
Yeah, great. I mean, yeah, you reminded me of way back when in Arizona when we thought about all the different breaks throughout the system, from intake to response to in-home and out-of-home and permanency. And there was all these areas where warm handoffs just didn't occur because everybody is so overwhelmed with what they have to get done and what their particular role is in the process, that they don't really think or even know much of the time what the next person in line is experiencing as the case goes through the entire continuum in child welfare. So it was really revealing to see that. And your word was perfectly said, empathy. People started to realize the effect that was having on the people within the organization doing work for the benefit of children and families. So just a great example there. So
yeah, we're
Christine,
going to talk more about lived experience, and that is really what happens,
yeah.
and that's so critical to this process.
Yeah, exactly. So, well, great. Christina, so why did Virginia see human-centered design as a big part of their move forward and transformation?
Well, as a human services agency, it seemed only right to include those who are using the system, which are our end users, our locals, and to include those with lived experience, those who have had experience throughout the child welfare system ahead of the design, development, and implementation of a new system. And throughout this webinar, Heather, I, and Chris will be utilizing the term design, development, and implementation. We'll probably use the term DDI just to shorten it a little bit, just to let y'all know. And then just to give a little background, Virginia currently has a main legacy system called OASIS, which stands for Online Automated Services Information System. It has been around since the late 90s, if you can believe that or not. And it has limitations such as being a desktop app, which really makes it unable for the frontline users to use it in the community. So back in 2019, Virginia implemented Compass Mobile based on feedback from supervisors and frontline workers, and that they wanted to be able to do work in real time in the community with families without having to come back to the office. Mobile was really critical to frontline workers being able to do that work and engage with families. And so that we knew during when we rolled out Compass Mobile, we used doses of human-centered design then, and it really was impactful. We met with frontline workers, supervisors, directors through meetings, through webinars, surveys, did user testing, all of those those types of things. We knew we really wanted to implement that as well. And then a year later, we also had a smaller scale project as well, which was the Virginia Child Protective Services Mandated Reporter Portal. And we included, human-centered design touches in that too with our community partners. We utilized them for testing that and throughout that. And we know that that was impactful. So when we got to this point with this huge project, with all that knowledge, we knew that it was important to use a resource-based approach to allow us to understand the needs and pain points that users had ahead of that DDI, so we would not make the same mistakes that are often made with large system transformations. So what I will say is that we're very fortunate to have the division and leadership support throughout the process, and for allowing us to utilize this methodology. We know that we needed to build a system for the ones that are using the system, which we'll refer to as our end users, and those that are impacted by the system, which are those with lived experience. Like Chris said, we'll be using those terms throughout this webinar. And then also involving all levels of users early on also supports the PROCE method of change, right? To bring that awareness and desire on. And it's so valuable for Virginia because we have a state that has 120 locally administered agencies, and you'll hear about this uniqueness throughout this webinar.
Excellent. Thank you very much. And my compliments to Virginia for doing these amazing incremental modernizations for your people and the mission. Not waiting years to get a whole big CCWIS implemented, taking the steps to really improve and bring outcomes earlier with your mobility and your central intake system. So mandated reporter system. So my compliments. But so Heather, obviously our federal partners in ACF are a big part of CCWIS implementations around the country. What kind of efforts or what kind of work are you doing with ACF in terms of supporting human-centered design in your transformation efforts?
Well, of course, the first step was to make sure that we did include a budget item for human-centered design in our APD, and of course to ensure that it received approval. We did stay in contact with our federal partners, kept them informed of all the aspects of our HCD process. So making sure that they understood the methodology that we were going to use, and also our procurement strategy. We did send a draft to them prior to our official submission. So as always, they were willing and able to assist us with that, review that draft for us. And of course, because of that federal financial participation, that FFP, we did have to send it in for official approval. So we did that prior to be able to proceed with the final contract. And I just wanted to also say that ACF has been very supportive throughout our entire HCD process. They have acknowledged our efforts in Virginia. And for those of you that may not know, ACF also did publish, I just want to give a little plug to ACF here. They did publish a Did You Know back in April of 2024, and also the HCD Toolkit in January of 2025. So we found those to be, really exciting, great resources for states. So I just wanted to give that plug for other states. If you haven't seen those, go check those out.
I always do it at least once. So good. Thank you, Heather. So Christina, human-centered design, it sounds pretty easy, easier said than done. And I don't think it probably is. So can you share with us a little bit about the process?
Yes, it's a lot. It is definitely not easier said than done, right? It's definitely been a fast-paced project, and I will say it's been wonderful working with EY. And before they even got on board, we really did have to start communicating out that we were going to do human-centered design. With change management, people have to hear things 15 times, right? So letting people know we were going to, do HCD was huge. So communication was key to provide locals and those with lived experience, knowing that their voices were valued valued and were going to be needed through HCD. And so, again, I just want to preface, we want to let this be known too. We in child welfare recognize that individuals who directly experience the child welfare system as parents, or those who indirectly as extended family members and community supports, have a unique understanding of how the system works. And we use that term as your lived experience to refer to them. And then our state and locals are typically referred to as end users. You'll hear those terms throughout this webinar, and Heather's going to talk a little bit more about that later too. So one of the processes was identifying the state, all levels of local, state, and lived experience that should participate in the process. Locals had to complete a survey to determine which sessions they should participate in. EY and us partnered to determine which tracks we wanted to have sessions on. So those surveys helped the workers decide which tracks they needed to participate in. And the local the lived experience were sought out through the Virginia Department of Human Services Parent Advisory Board, which is a group of birth parents, and then Speak Out, which is a youth advisory board for teens and young adults in foster care, and the alumni, which is the adults that were previously in foster care. We used ages 18 through 28. And then we sought out resource parents, kinship and non-kinship, adopted parents, kinship and non-kinship, and those were recruited differently because there were no selected groups available. So we had to do a lot more recruiting for that, collaborating with state and regional consultants to get those contacts. So taking this step, and then we also wanted to go a step further and ensure that we took the steps to ensure there was funding secured so that our lived experience participants could be compensated for their time, because that was a huge priority for us. It was critical that they knew that their voices were valued too. So that was a huge thing. And then also making sure that we coordinated those sessions after hours so it did not conflict with their work schedules. Those were some core values that were important to us. And next was coordinating the mass coordinating that went on, and EY was a huge partner with this, conducting those virtual gathering and validation sessions from September 2024 to January 2025 to ensure that all state staff and all levels of local government, Department of Human Services staff and those with lived experiences were heard. And Heather and I, we actually sat and observed in those gathering and validation sessions based on our current roles in our team, and also that we both had a wealth of frontline experience too. And we conducted debriefing sessions with EY for that continuous quality control and tweak things as needed on an ongoing basis. And Heather's going to talk a little bit later on about that. Some challenges, if they came up, we overcame them and moved forward. And then to further expand on the process, EY completed one-on-one site visits with 2 agencies. And this is because when people are telling you about what they do, they may forget that they may have something on their wall, a corkboard that they may have a process, or a notebook that they may forget about. So EY really took that extra effort to go shadow workers in those 2 agencies. And they were 2 different size agencies, was important too, in 2 different regions of Virginia, because Virginia is very vast and with their diversity too. So EY was able to go do that, observe the process of actually how they did that work too. And then we finalized the work through state and local voices by an in-person 2-day meetings through EY's wave-based technology. So as you can see, it was very fast-paced from September to January.
For sure. Well, herding cats, to say the least, in the midst of a lot of very, very, very busy and stressed people doing important work. So I know that's always half the challenge, is to get people to participate in the midst of all the pressure. So excellent job in doing that. Chris, do you want to fill in any blanks there with what Christina said in terms of the process from your standpoint?
Well, I'll define one thing, the wave space that was just mentioned. So that is an interactive workshop process that we conduct. So think about your traditional workshops where you might have sticky notes and whiteboards. We've taken and digitized that experience. So people are looking at things like personas and journey maps live on these large interactive either 80-inch or 60-inch screens, depending on the format, and updating those things in real time, and everyone can see what everyone else is doing at the same time. And that, we find that to be a very helpful process. I know there's a question about change management, and the lines of human-centered design and change management are blurred. I can talk more about that at the end, but really the reason we do those type of workshops is people tend to support that which they help create. So by getting everyone to roll up their sleeves and actually tailor those journeys and processes for themselves, when they go back to their local office, they feel a sense of ownership that they might not otherwise feel.
Yeah, you hit that right on the head. I think that as somebody that was part of a big CCWIS implementation, and seeing the effects of that over these years by other states and agencies that have done it, I think the impact of early change management has really been seen and felt. So the need to really start doing that in the very, very beginning stages. So excellent work. So Christina, how about benefits? I mean, what have you seen? What have you seen? What good has come already? Can you share some of the benefits with the group, the audience?
Definitely. We've seen so many great benefits. And like I said, Heather and I were in these gathering sessions. So it was really, we got to see this, for our own selves, firsthand. The attendees of the gathering and validation sessions felt heard and included. Their input was able to be used for change management and further HCD efforts throughout the DDI of the system. And this process has really built relationships with locals and those with lived experience. And it really reinforced the message that this system is being built for them, by them. And that's huge, And so these products that EY has developed, the HCD products that they're developing in documents will really show this future workforce that maybe who are not here now, who didn't participate, all the work and the voices that were heard to develop it. So that's really a huge long-term benefit that we have going forward, because it does take a while to build a new CCWIS, right? And then also one of the unique things that we found out was that some of the pain points of the participants that we had were not actually pain points, truly, they were actually only unawareness. We know that workers have very challenging roles, and that turnover is one of those things, right? So as they're managing turnover and the high demand of their own positions, some did not realize the full capability of the current system, which includes Compass Mobile. And this was actually a huge benefit to us, because now we can actually go re-educate them, and they can use some of the technology that we already have to become more familiar with using that in real time, which will help them use the technology that we're going to be having later, right? So our communication plan leading up to HCD was really promoting workers using all the features of the current system to be able to provide us feedback and pain points to aid us in the design of the new system, right? So with this information being captured in the HCD session really provides our team points to target education, so we can increase this usage of features so that local users can provide us with meaningful feedback, as we continue this work that we're doing. For example, we have like the permanency assessment tool in Compass Mobile application, which is a tool that promotes kinship in all program areas. So we're not working at silos, right? So we would love to get true feedback on that functionality as we're going forward. So that would be great. And also the sessions were a true benefit for our team as well, because many of the wants we actually saw were in our requirements. So it really was affirming that we're in alignment with the participants too. So those are just some great benefits that we saw thus far.
Excellent. Okay, so all things that are worth it, or all good things come with challenges. So Heather, you get to talk about some of the tougher points of this. Fill us in.
Sure. So we did see some really great benefits from this, but yes, you're right. There are definitely challenges with any project, anything that you start working on. We did learn in the very beginning, we did have our project kickoff, and that included our executive leadership, our stakeholders, and really we learned to just kind of maybe take a step back before we do that official kickoff. Let's get some of those logistics out of the way, identify our participants, identify what tracks that Christina talked about earlier, what programmatic areas that we were going to focus on, how we were going to identify those users and those participants. So I think if we did this again, we would do all that kind of prior to scheduling our official kickoff. We did learn that scheduling is a huge issue. Of course, you know, Christina and I, coming from a local agency ourselves, you know, workers are not at their desk. They are not available to always participate in, you know, these virtual gathering sessions. So we had to kind of take a step back, offer more frequent sessions with larger amounts of participants because we knew we weren't going to get everybody on the call that day. So emergencies arise, you know, workers would have to drop off during a session, and that was okay because there would be another session that they could come back to if they needed that. So scheduling was a challenge, but EY was great. We worked through it. We were able to modify our schedules and keep going forward. Another reason why it was really important to take that step back and modify our schedule is because we really felt it was important, being a locally administered, state supervised state. We really wanted to make sure that all of our localities, whether that be different size localities, um, different areas of our state, we really wanted everybody to be able to participate. So again, modifying that schedule just to make sure that we could meet everybody's needs. Also, Christina previously mentioned our lived experience. We thought it was extremely important to provide compensation to all of those that participated in those lived experience sessions, whether that was a foster care alumni or a foster parent, birth parent, adoptive parent. We really wanted to compensate them. So the logistics around that, finding out how we are going to secure this procurement method, how we're going to do that, what form of compensation we're doing. For us, that was Visa gift cards. So just the little logistics that you don't really think about. How are we going to get this to them? How are, you know, they have to fill out their W-9 forms first. We have to make sure we get those back before we can send those cards. So just the logistics around it all. But again, I mean, we were able to work through everything. It turned out great, but just all the little things you don't think about in the beginning.
For sure. Yeah, and thanks for sharing that context about Virginia and how it's made up, and as a county kind of system. There's obviously people on the call as state administered, county administered systems that know there's going to be some nuances to doing this. So I think that really helps people make an informed decision on how to proceed. Well, how about other learnings, aha moments, you know, or surprises that you experienced in this? Any of those, Heather?
I think as Christina said before, we did and as expected, we did know this. Many of our participants were not fully leveraging our current systems, which did limit their ability, or not limit, but just have a different perspective to the feedback that they were providing on their key pain points with the system. And again, like Christina said, it's just that lack of awareness regarding the available features. So it really gave us an opportunity to know exactly where we can focus some training and some refresher trainings for that, so that when we continue to go through and use HCD throughout our process, we can, sorry about that, we can, you know, really get some deeper pain points from them. So we are going to be implementing some training around some of our features. We also, not a surprise again, but just a re-emphasis on breaking down the silos and the importance of that. Our current system is very case-centered instead of person-centered. So we have some foster care workers, for example, that don't have access to the family's entire CPS history. So, we know that moving towards a CWIS, we really need that to be person-centric. So we heard that loud and clear in the HCD sessions. So they need to be able to see that entire history of that family easily, instead of having to go search for it. So that was another takeaway. Also, at the end of each gathering session, they did talk about EY always asked, if you had a magic wand, what would you want to see in the system? So, of course, the majority was one system. I know Christina talked a little bit about our legacy systems, but we do have several right now that our workers have to use. So, of course, that was overwhelmingly the outcome of that magic wand question. Um, so we do know that that's a struggle. We want to recognize that. We heard that. I think our frontline workers felt really valued and heard, and understood that we hear you loud and clear. We know that that is a struggle that our frontline workers face every day. And so, after years of dealing with such antiquated systems, I think, it's no surprise that they just want an easy to use one system, comprehensive, where they can go and get all of their work done. So again, not a surprise, but definitely we needed to hear that. And we need to, another thing is that our participants were very excited and wanting to participate, wanting to have their voices heard. And so we are going to be continuing to use HCD throughout our DDI process. It's very important. We're committed to that. So I think that's another kind of lessons learned from this as well.
Well, excellent example as well. So Christina, Heather just mentioned a few things that they've heard from staff, but give us some more. What's the staff? What are the staff saying around the state of Virginia, counties, everywhere? What are they talking about?
They definitely want more of it, they thoroughly enjoyed being involved in the process. They feel more invested in it, and they really appreciated us listening to them, the good and the bad. They knew that they got more out of it than expected. They were thinking they were going to come in and maybe not share, like, wow, I really did share a lot more than they thought. And then they found that it was actually, they got support in the space, that they were in a group of people who did the same things that they did and were struggling with the same competing priorities. It's not just them. So that was a great safe space for them to share. And then they realized through the process that there's so many different ways to do something. And especially during the wave space experience, and Chris explained a little bit more about what that was, that they wish that there was one way to complete a task, right? Making things easier to do, a little more streamlined. But they also knew, being in that room, that but with 120 localities, that it would be a challenge to do it that way unless it was guidance that directed that too. So they understood that there would be some challenge with that. But they really wanted to be included in the future opportunities for the HCC. So I really think we built some really great relationships to keep this going.
Okay, so you're talking about future opportunities. So Heather, how will HCD, and we all have a new acronym, it looks like, in American Human Services, how will it be incorporated into your future work? How will it show up?
Sure. So it was very important, like I said earlier, to really do this work ahead of our DDI. We wanted to make sure we were prepared before we bring a vendor on board. We really knew what our users were wanting and what they were needing. So for our future, we are going to definitely include the new requirements that came out of our sessions. We're going to include that into our requirements traceability matrix, our RTM. We also have some revisions to our workflows. So we will be doing that. And of course, that's going to be, living, breathing documents. So we will be updating those, of course, throughout the process of our DDI. And, saying before, we're state supervised. There's no denying that there are challenges of having that set up. However, we have to make sure that all of our localities, all of their needs are met. So we heard from the majority of our participants that they would prefer more standardized business process flows across the state versus a lot of diversity in regards to the way they do the work. So there are going to be things I think that the state can, make a little more streamlined throughout all localities. And then there are going to be also those that we need to make sure that we are taking into consideration that each locality may do things slightly different. And so there could be ways that we're going to need to incorporate that and make sure that there's room for that in our new system. So that was really important to hear. You know, I was kind of expecting the opposite. They would say, no, we need to be able to do it our way still. And we really did hear a lot of, help us all do it one way. And that was really important to them. We are also, I think, stating before, we're going to continue to use HCD. That is 100% our intention. So we are going to seek out a partner as far as a vendor who's going to understand that importance and really work with us as we incorporate that HCD through our CCWIS project. And, we really just want to partner with somebody that understands that our frontline staff, our stakeholders, people with lived experience that we are working with, they're at the heart of this work. And so we have to make sure that we continue to incorporate their voice throughout the process. So I've already touched on this piece a little bit, but just wanted to make sure. Virginia, like I said, we're very committed to HCD and to, of course, continuous quality improvement. Our business processes, our enhancements, we are going to make sure that we integrate those into our future initiatives, whether that be with CCWIS or anything else. I think personally being a project manager, stakeholder management is one of the most important things that we need to make sure that we manage well. And I think Christina, being our organizational change management consultant, she is going to really have the toughest job because there's going to be a lot of OCM that comes with implementing a CCWIS and making sure that we continue to incorporate that HCD. Also with stakeholder management, I think it's also important to acknowledge that our workers, they want it all. And they want all the bells and whistles, and we want to give them all of that, but we cannot do that on the first iteration. So again, managing their expectations to know we have to meet federal requirements. We have to do things in phases, and we will get there, but we're not going to get there on day one. So just managing the expectations of that while making sure that we are in full federal compliance.
Yeah. Well, we just heard Heather say HCD is part of their CCWIS approach. So, Christina, any other areas of Virginia's child welfare modernization or work in the future that is going to incorporate human-centered design as part of its flow, so to speak?
Well, Virginia plans to keep this momentum with HCD and utilize these practices in all areas of our system modernization, as well as our programmatic and training aspects as well. And then the products from HCD that EY gave us is going to be that roadmap that we can engage, our state, locals, and those with lived experience to ensure that their voices are uplifted. And right now we do have a lot of great ways that we have to engage our locals, and we're just going to keep them engaged with that. Too, right now we have our channels. Right now we have our Compass Advisory Committee, which is a work group of directors from all 5 regions of the state. We have our Compass Navigators, which are frontline worker representatives from each agency. And then we have our Compass Lifelines that are on Fridays, which actually started out as readiness calls during Compass Mobile rollout, and they've actually evolved to information and feedback platform, really attaching that Y to the technology to utilize them, highly collaborated with programs to utilize that. And we plan on involving and really incorporating more opportunities to engage participants that were heavily involved with the HCD sessions, because we really got a good group involved, and we'll keep that momentum up. And we also want to make sure that we leverage those lived experience participant groups that we had, like I said, those resource parents and those adoptive parents that we gathered for that. We really want to keep them, because that group really found that they enjoyed the space that that was provided for them during that time as well. So we want to make sure that we keep that going and utilize them for at any possibility that we can when there's changes.
Okay, so with everything comes a policy transformation. So can you talk about that?
I sure can. The local Department of Social Services requested, they all requested that we explore how to make the child welfare guidance more friendly, right? How can you search in it friendly, all things. And some of the thoughts was that there was too much guidance in some areas, while other programs needed more. They wanted something to be a little more congruent. So VDSS actually contracted with EY, who partnered with us for this partnership, and to focus on the child welfare guidance, really to work through this. They're taking a closer look at existing policies to understand the overlaps, the gaps, potential areas for conflicts, and to find opportunities to simplify them for better understanding and adoptions. Also to analyze the existing child welfare guidance framework, development process, and delivery system, right? So they're also going to map out federal and state regulations and identify areas for simplification, really to make it a little more simple for being able to look at it. And then this work is truly exploratory project to help guide future phases of modernization for our child welfare guidance, while impacting the retention of our child welfare workforce. Remember that retention I talked about and that turnover that's impacting everyone, so this is going to hopefully help that as well, and ultimately create a better user experience and family outcomes.
Excellent. Well, great. Chris, I want to bring you back into the conversation here because we did get a question that we wanted to direct towards you. And I like the question because it's somebody who's clearly been in this work for a long time. And the person asks, says since 1998, the start of their tenure, they've been discussing that, understanding the user community and the needs are essential in any part of system design. And I talked about in Arizona, we saw how everything affected everybody along the way, how it affected humans throughout the process. But, it wasn't intentionally human-centered design. And now this is an amazing thing happening. So this person wants to know, how does human-centered design improve on these techniques that this person's been taught for the last 25 years?
Yeah, it's a great question. And, I think I'll start off by saying that human-centered design is not a new discipline. It's been around since the 50s. And so it has, there are lots of other methods for system improvement that use some of the principles of human-centered design. But I think some of the differences in terms of a classic system design exercise that may involve users is, first, we think about the totality of the experience. So not just the system itself, but all of the interactions through that system. So you think about CCWIS as an example. From a family standpoint, their first interaction is not in a CCWIS case. It's in an investigation, right? Or some other exercise that happens way upstream. And there's a lot of emotions that are accompanied with that, and a lot of fact-finding about information that probably happens on an internet search, not in a system. So we have to think about how all of those pieces contribute to the whole, and really think about the experience versus the technology. At the end of the day, there's still technology requirements that are developed, but our core artifact is not, one of those Excel spreadsheets that has lots and lots of individual system requirements. They are the journey and what is happening to an individual as they go through it. The other thing I'll say is that some of the principles behind the research techniques have a little bit more sensitivity to them, right? Because we're talking about lived experience people. And when I use the word lived experience, I'm talking about families, children, right? The recipients of these programs and services, not the user experience of the caseworkers, though we look at that as well. So talking to those people in a trauma-informed way and making sure that we're asking probing questions, but we're doing that in a way that is respectful and getting us to answers that help improve the outcome are some other HCD-specific disciplines that I think have a real big impact on the system design, but it's a great question.
Yeah, thank you. Well, great. So we have about 9 minutes left, and we don't have to go right to those 9 minutes. We all know how things go over. So, but we might have, maybe 5 minutes for, and again, just to talk about some of the questions in the Q&A, are maybe more detailed than we're going to be able to answer in this session, but you're not being ignored. We can catch up with that after. But maybe anybody in the audience have some questions specifically for Chris as it relates to the things he said and the part that the role that he and EY played in all of this. If anybody wants to raise up or come off and ask a question, I think they said we could take a couple for Chris.
There's one, if we don't have a hand, that I'd love to address. I'll take some of the easier ones. But there's a question here about job satisfaction and turnover. And it's a great question because, the number one thing that an organization can do to improve their customer experience is to improve their employee experience. And numerous research studies have borne that out, that you can spend lots of money on technology and a bunch of other things, but if your people feel that they're unsupported in their job, that will have negative ramifications on the customer experience. So when we think about these things and when we do this work, we do look at that employee experience and what are the tools and processes that they have in support of the mission and make some of those recommendations with the goal of improving employee satisfaction. And there's a variety of different ways to measure that, right? Everyone has some version of an employee survey or a CEO survey that can help gauge those things. We also look at some of the hard data, like the type of help desk calls that are coming in. And if we can start to see a reduction in very basic type of help desk inquiries, that often means that people are getting to spend more time on the mission, again, which is why they got into this work in the first place, which improves satisfaction. So the combination of that and feeling supported by tools and process often can uplift that employee experience, which has disproportionate impacts on the customer experience.
Yeah, I agree 1,000% as a former leader. So, anything else you wanted to take, Chris, that you saw in that Q&A? Or
all right, let's see if there's any other easy ones.
Any hands in the air? I don't see any hands, but I don't know if I can see the whole world out there. So if there's anybody up there, let us know.
I touched on this one. There's a question about the intersection of human-centered design and change management. And the two things in my mind really are complementary halves of a whole, right? Human-centered design infuses change management techniques very early on in a transformation process by engaging people, getting their opinions, making them feel heard, and getting them to participate and co-create on what that solution looks like. And the more people feel heard and feel like they have their stamp on that end state, the more likely they are to go back to their day-to-day and really evangelize the impact that this can have. And it can't be a one-time exercise, right? As any of the OCM or change management people know, it has to be an ongoing process where they're re-engaged and they don't feel like they've contributed information that's not being used. They can actually start to see the tangible implications of their participation in those end products and end process changes that are implemented.
Yeah, perfect. All right. Well, with a few minutes left, I just want to say a few thank yous. I want to thank Chris. I'm new to EY. I got the pleasure of meeting Chris, and it's nice to see people outside of government that just feel the mission and get involved and really are emotionally involved in making a difference. So I like that, and I appreciate it as a former leader in government. And want to obviously thank Heather and Christina for all of your hard work and for sharing your learnings with us today, and for continuing to move Virginia forward for kids and families there, and for making the time. I know it's tough, so thank you both. Obviously want to thank APHSA for making this learning possible and all the things that they do to support us doing this work. And obviously everybody who attended. So to all you who have joined, I hope you learned a lot about human-centered design and the how and the if and the what and the rigors of doing such and the rewards of doing such today. So, and thank you for the work that you do out there for kids and families and government. So with that, I think I will give everybody 4 minutes back in their day, which I know everybody appreciates it, and say we will see you another time, and the best to everybody, and we'll close out here. Take care.